Hello everyone, this is next in the series of image to diagnosis general sonography, fifth in the series of urinary tract. This is a 41-year-old woman, history of hysterectomy 3 months back, increasing incontinence of urine since then. The coronal scans of the right and left kidney are seen, and the lower one is the sagittal scan of the pelvis. And you don't see the uterus because of the hysterectomy. So what is the finding? Are you able to appreciate anything positive? Now this case is to illustrate the importance of provisional clinical diagnosis, logical analysis, and pattern recognition, and extension of technique possible with ultrasound. So if you would like to see the workup of the case, please log on to sonoshare.in, go to image to diagnosis, general sonography, urinary tract, fifth case. Thank you.